Alzheimer's disease is degenerative, which means it becomes worse over time. Learn what to expect as Alzheimer's progresses.
Alzheimer's disease is a degenerative brain disorder which usually occurs in people over 65. Alzheimer's is fatal when the body ceases to function due to a complication of the disease, such as pneumonia. This disease can last anywhere from 3 to 20 years, averaging about 7 to 8. The first sign is memory loss, followed by personality changes and progressing to a loss of control over bodily functions. These changes gradually happen in a generally distinguishable set of stages. In the earlier mild stages of Alzheimer's, symptoms are not immediately evident. Then a patient will begin to suffer small memory lapses, such as forgetting the names of familiar places or people. As Alzheimer's progresses, the afflicted individual may experience confusion about everyday tasks and people. They often become disoriented about time and place and tend to exercise poor judgment. More than 40% of people with early-stage Alzheimer's exhibit apathy about their life and condition. People with early-stage Alzheimer's can often continue living as they have been for some time, particularly when prescription medication is taken. However, the ability to live independently may be lost as an individual enters mid-stage Alzheimer's. At this point, patients often lose cognitive function rapidly, forgetting recent events and even their personal history. They may have trouble sorting out the names and faces of familiar people and often forget personal information like their home address or telephone number. Mid-stage Alzheimer patients experience personality changes as well, often becoming withdrawn. In addition, they may exhibit paranoid behavior and often can have hallucinations. People with mid-stage Alzheimer's have an increasing dependence on others and may need help eating, dressing, grooming, and using the toilet. Gradually, control of body function begins to decline as a person enters late-stage Alzheimer's. People in the late stage require around-the-clock care. People with late-stage Alzheimer's usually won't recognize others or even know their own name. They can no longer communicate or move around without assistance. As Alzheimer's runs its course, the body slowly shuts down, and a resulting medical condition like pneumonia will lead to death. Although Alzheimer's disease is fatal, prescription medications can often help patients maintain their quality of life for longer periods of time. The personality changes, cognitive lapses, and eventual demise of a person with Alzheimer's disease are extremely difficult on both patients and their loved ones. For this reason, it is important to seek guidance and support from a doctor and care team.
Want to learn more? Check out other videos and sources on this site for more information.